Hey guys, it's me, Tamika, and I'm a board certified psychiatric mental health nurse practitioner. If you have been rocking with me since day one, welcome back. If you are new to the channel, welcome. I also go by the name The Flagrant Psych MP, and I run a private mental health practice here in Michigan that's 100% virtual. And at that practice, I'm managing adult patients with ADHD and mild to moderate depression and anxiety. Here, though, on this channel, what I do is I'm providing mental health educational content to help empower you, to help you understand how to navigate this mental health landscape a little bit better. And then I also have this personal mission to do my part to help decrease the stigmas surrounding mental illness. As you can see, before we jump into the video, I'm all caught up with the holidays. In the last video, I still have my Christmas nails, but as I'm recording this video today, it's actually Valentine's Day. So by the time this video reaches you, though, the holiday will be over. But if you celebrated, I hope you enjoyed. But let's get into today's video. If you've been following over the last couple of weeks, then you know that I started a series called Focus Now, basically where I'm breaking down ADHD, right? And in that first video, I gave you the modern definition of ADHD, just a high level overview of basically what ADHD is versus what it's not. And I also dispel some myths surrounding the disorder as well. So, if you haven't had a chance to watch that video, you definitely want to get caught up on that because today starts the second video of the series where I'm actually going to be talking to you about how we clinically diagnose ADHD. What does that process look like? And so, if you've ever wondered, like, do I really have ADHD? Or, why did it take so long for my diagnosis? Or why was my diagnosis so quick? I think you're going to find value in today's video. Now, I would venture to say that diagnosing ADHD is probably one of the most misunderstood parts of mental health care. And I say that because you're going to find that some people are waiting years and jumping through hoops just to get an initial evaluation or even just to be taken seriously. And on the flip side of that, you have some people who are getting a diagnosis on the very first appointment. And then if you try to do your own individual research online, that's probably going to confuse you even more because you're going to find that people are saying there's no real way to diagnose it. To you just need to try a stimulant to see if you have it or not. And I actually had a patient tell me, and this is no shade to the PCPs, but I actually had a patient tell me that their primary care provider told them to do this, right? But we're going to clean this up today. I'm going to walk you through the way ADHD is supposed to be diagnosed, what we consider the gold standard clinical process for diagnosing the disorder. And I'm going to let you in on this as well, okay? Some of my MP colleagues are not going to be happy with me for doing what I'm doing right now, right? So there is this concern or worry that if we openly share the criteria with the general public, that people will just start to memorize the criteria and then just regurgitate it at a clinical, evaluation. And while I can understand and see the concern, a solid ADHD diagnosis requires us to look at everything from, patterns, history, impact on your day-to-day life. So I will say, as clinicians, if we're doing our jobs well, transparency isn't the issue that I think that it's being made out to be. So when you hear us as clinicians use the term gold standard, what that means is that it's the best available method to make a clinical decision or diagnosis based on the nature of the condition. So when it comes to ADHD, and this is the one most important thing that I want you to take from today's video, and that is that there is only one evidence-based diagnostic framework that we use to diagnose this disorder. Now, is it perfect? Is it always applied well? No, it's not. I'm just going to be honest with you. But that thing is the comprehensive, evidence-based clinical evaluation. So ADHD is a clinical diagnosis, not a biological one. And what I mean by that is that when when a clinical diagnosis is being made, it's made by a qualified healthcare professional. It's done with like deep observations, detailed interviews, diagnostic criteria. We're not using like labs or scans or any type of imaging or anything like that. We're not using any of that to make the diagnosis. Now, when we talk about a biological diagnosis, now this is where labs and imaging and genetic testing and all of those things come into play. You're using something very direct and measurable to say, oh, yeah, you have this. So, for example, if I take your blood pressure and you consistently come back with numbers that are not within normal limits, I can then confidently say, okay, you have hypertension. The same thing with like diabetes. If I'm checking your blood sugar or your A1C and they're consistently coming back elevated, now I can confidently say that this is diabetes. Can't do that with something like ADHD. And that's again why it's called a clinical diagnosis. And so, in saying that, I think it's also, I have to mention that I know that there are some providers who will use imaging as part of their diagnostic process. For example, Dr. Daniel Ammon with Ammon Clinics. Now, he uses SPECT images or SPECT scans to help understand like different blood flow patterns in the brain. And that's a very, it can help guide treatment. It's a very supportive tool, but again, it's not diagnostic. There really is no one single objective test that you can use to definitively say whether this is ADHD or not. The diagnosis is really made by, looking at patterns, symptoms over time, and the impact on your life. And then that has to be done by a trained clinician. Now, does that mean that ADHD is fake? It definitely does not. The way that we diagnose ADHD is honestly no different than the way that we would diagnose any other psychiatric condition. So there's not always going to be a single appointment or a single form that you fill out where everything just suddenly becomes clear. And really, as your psych liaison, what I encourage you to look for in evaluations is thoroughness. And to be clear, thoroughness doesn't always equate to like a battery of like psychological testing or neuropsychological testing. And I call these two out specifically because I've seen this in clinical practice firsthand where patients are telling me they're being delayed care because some providers are insisting on these type of evaluations to prove ADHD, so to speak. But again, the true basis for the diagnosis is a careful, evidence based clinical evaluation. It has to be done by a trained healthcare professional who's qualified to assess mental health conditions. And what, providers can diagnose and prescribe, that's going to vary based on where you are. So with that, I'm encouraging you to do your own research about the laws in your geographical location. So let's get into the DSM-5 criteria surrounding ADHD. And we talked about the DSM-5 in another video very briefly, but in short, I just told you that's the manual that we use as mental health providers to help us understand what are we looking at. It helps us to understand what we're diagnosing. And so ADHD is no different. We use criteria in the DSM-5 to help us understand, is it clinically appropriate to diagnose ADHD? But before we dive into that criteria, I do have one quick heads up that I want to share with you about the current criteria for ADHD. So basically, the criteria that we're using in the DSM-5 for ADHD, you got to remember or keep in mind that this criteria was largely created around studies of young boys and specifically young white boys. And so, when we're talking about assessing and diagnosing adults and women and people of color, they're not always going to fit into those boxes, right? And so skilled clinicians are aware of this. And so when we're doing evaluations, we look at your symptoms in context, meaning how are they showing up and impacting your daily life. We're looking at your history. We're focusing on patterns over time, which help us better understand if this is ADHD or not. And so clinicians have to be careful not to box themselves in with that current criteria, because if you don't put all of these things into context, this is where you can get into an issue, where we're misdiagnosing people. So now that I've gotten that all out of the way, let's actually get into what the diagnostic criteria is looking for an adult ADHD diagnosis. And I also want to say this, right? It's not about having all of these symptoms that you're going to see here in a minute, um, or feeling this way once in a while. To clinically consider ADHD, there need to be at least five ADHD related symptoms that show up consistently. They have to have been around for at least 6 months or more, and the symptoms have to be more intense than what's typical for someone your age. And so here you're going to notice that these are the different ADHD presentations that I told you about in the last video. And we're going to start with the inattentive symptoms. And so these are a lot, right? I'm not going to go over these individually, but just take a look at them. They're about 1, 2, 3, 4, 5, 6, 7, 8, 9 inattentive symptoms. And before, we got into the criteria, I told you that you needed to have at least five of these ADHD related symptoms to be considered ADHD inattentive type. Okay, so I'll leave those on the screen for a minute so you can just take a look at those or screenshot it, whatever you want to do. And then we're going to move into the hyperactive or impulsive type of ADHD. Again, I won't go over all of the symptoms individually, but again, you're going to see 1, 2, 3, 4, 5, 6, 7, 8. If I counted that right. 1, 2, 3, 4, 5, 6, 7. Yeah, 8 hyperactive impulsive symptoms. And again, to be diagnosed with ADHD, hyperactive, or impulsive type, you have to meet at least five of these criteria points. Again, I'll leave this here a little bit so that you can review it at your own leisure or take a screenshot so that you can look at it later. And then we're going to move on to the combined type. Now, to meet criteria for ADHD combined type, remember I told you that's a combination of being inattentive and hyperactive at the same time. You got to meet at least five criteria points from both categories. So both inattentive and hyperactive. So we're talking 10 um, symptoms or criteria points total that you're meeting. And that, would clinically satisfy a diagnosis of ADHD combined type. And I mentioned this in the last video as well. Remember that, the onset of ADHD is, you're going to see the symptoms of this disorder showing up and impacting your ability to function across different settings, like at home, like at school. You're going to see them present before the age of 12. Okay. Now, this doesn't mean that you had to be diagnosed as a child, but what it does mean is that these patterns existed even if they were missed or masked or misunderstood. Okay. And then the third thing, this is the third criteria point that we're looking for, multiple settings. And so again, ADHD isn't something that you can only struggle with in one place. And even though it can look different depending on the situation, the symptoms are persistent and they usually impact you and show up across more than one area of your life. So when we're talking about adults, a lot of times it can look like at home, you're not functioning optimally at home. You're struggling at work. So this is what this means when we say multiple settings. Okay. The other thing that we're looking at is there has to be some type of functional impairment. Now, I tell my patients all the time in clinical practice, like, you know, it's not just enough to tell me that you have the symptoms of ADHD, because I can show all these symptoms to the general public and they can identify with them as well. What makes this more consistent with ADHD is, again, how often or frequently the symptoms are occurring. And then also, how impactful is this for you, right? And so this is a big one. The symptoms have to cause real impairment, not just annoyance, not just, I could be more productive, but there needs to be actual interference with daily functioning, or emotionally, like emotional dysregulation, social issues, academic issues, or, issues professionally. And so those criteria points are some of the elements that we are looking at when we're trying to make that clinical diagnosis of ADHD, but it's not all. And so I'm going to go over some additional things that we're looking at as clinicians to make sure that we're being thorough when we're trying to make this diagnosis. And so I mentioned earlier how there's only really one, evidence-based diagnostic framework for diagnosing ADHD, which was the comprehensive evidence-based clinical evaluation. And part of that includes the clinical interview. And this is really the backbone for diagnosing ADHD. Now, during the clinical interview, it would be appropriate if clinicians are asking you to expound on attentional difficulties. What type of impulsivity issues are you seeing, if any? Talk to me about organizational difficulties, time management. Tell me how these symptoms are showing up and impacting your ability to function on a day to day basis. And not only do we want to know about what's happening now, but it's very important that we understand if and how these symptoms were showing up for you in the past. We need you to expound on that as well. To support this process, a lot of times what we'll do, even before the clinical interview, we typically will administer an assessment tool that's called the ASRS. Now that's short for Adult Self-Report Scale, and it's specific for ADHD. Basically, what it is, it's a tool that allows you to self-report on symptoms of ADHD. Now, this is a very valid and reliable tool that we use in psychiatry. um, I don't even want to just say psychiatry, but it's a very valid and reliable tool that we use to help us diagnose ADHD. But this is very important because a lot of people get this confused. That tool is not diagnostic in and of itself. Okay. It kind of sets the stage depending on how what your responses look like or your results from that tool. It gives us a good indication about, okay, yes, this could possibly be ADHD. We need to assess further. So if you've ever taken one of these questionnaires and your results suggested that you have ADHD, it doesn't necessarily mean that you have it. It just means that further evaluation is warranted. Another component of a proper ADHD evaluation is going to be a detailed developmental history section where we're going to want to know, like, how did these symptoms that you are showing up and expressing today, how did you see them? How did they present in your childhood? Because remember, you know, to get that diagnosis of ADHD, or to, I don't even want to say it that way, but to be clinically diagnosed with ADHD, it's important that we know that these symptoms were present, before, remember, that target age of 12. ADHD symptoms don't just magically show up in adulthood. Now, they can persist into adulthood, and the symptoms may look different from childhood to adulthood. But we want to spend some time here and understand, like, what did your childhood look like? And all of that information is very helpful in helping us to understand, is this consistent or does this actually present as ADHD? A thorough ADHD evaluation is also, or it should include, a functional impairment assessment, right? And so, up to this point, you've probably presented with suspected ADHD, you've taken the ASRS, you show it's symptoms highly consistent with ADHD, you've explained how you're experiencing these symptoms across different settings. But now we want to know, like, how are these symptoms impacting your ability to function on a day to day basis, right? And so this is important because diagnosing ADHD is not just about showing up with presenting symptoms, but it's more about, understanding how are these symptoms significantly impacting your ability to function on a day-to-day basis at things like work, at home. How are they, the symptoms impacting you financially, emotionally? What is it doing to your mental health? Right. And so if I had to leave you with one key takeaway here, is that ADHD is diagnosed on how much it interferes, more so than about, how dramatic it feels. And, a responsible ADHD evaluation is also going to ask, what else could be causing these symptoms, or what else could be going on that's making a patient present this way. And so that should include screenings for things like sleep disorders, because when you're sleep deprived, your brain's prefrontal cortex, that's the executive part of the brain that we briefly talked about in that first video when we talked about executive dysfunction. But when you're sleep deprived, that part of the brain doesn't function well, just like in ADHD. Also, we look at anxiety disorders because an anxious brain is preoccupied with worry, and that definitely is going to affect your attention. Also, to be considered is depression. Now, depression can reduce dopamine activity. Now, we haven't spent a lot of time talking about the neurotransmitters that are implicated when we talk about ADHD, and we'll do that in the next video. But dopamine is definitely highly implicated when there's ADHD. That can also be reduced when depression is on board. And so that can definitely affect your drive and your focus. We also look at trauma related symptoms because a trauma affected brain is constantly scanning for danger. And again, this can definitely disrupt your focus. Something else to be considered is substance use because chronic use can definitely impair executive functioning, sometimes significantly. Okay. And then another thing that we look at or that should be looked at are medical conditions like thyroid issues or anemia. And so, an overactive thyroid can also cause restlessness and distractibility. Again, that can look like ADHD. And believe it or not, low iron levels can affect dopamine function as well. And again, we already talked about, dopamine plays a key role in ADHD. Now, I will say personally during my evaluations, if my patients tell me they haven't had any labs completed recently, I am going to order a set of comprehensive labs. And when those labs come back, I'm going to be looking for any pertinent abnormals, especially as it relates to the ADHD evaluation. And if anything comes back abnormal, we are typically going to spend time trying to correct those abnormals while the ADHD evaluation is ongoing. And to be honest with you, sometimes that can take several weeks to complete. Now, most of the rule out conditions, they are, either situational, episodic, or they have a trigger based course, which means if we can get to the underlying issue and resolve the underlying issue, you're going to see that most of the symptoms that mimic ADHD, those are going to improve. And that said, that's very helpful in understanding as a clinician, is this actually ADHD that we're looking at? But then again, this is also worth noting because um, if you have undiagnosed ADHD with uncontrolled symptoms, that can also lead to things like depression and anxiety. I mean, because if you think about it, if you're so overwhelmed with these symptoms, that can cause you to feel very anxious, which could then lead to feeling very depressed. And then also sleep issues. You'll find that research supports the fact that there are a lot of people who have ADHD who struggle with sleep. And typically, what it's called is delayed sleep phase syndrome, where the brain's internal clock typically runs later than usual. And so, the key takeaway here would essentially be, sometimes ADHD is the answer. Sometimes it's part of the picture, and sometimes it's not the primary driver at all. So, that kind of leads back to the term that I mentioned earlier, which was thoroughness. This is what you want to be looking for because a good ADHD evaluation is not about rushing to a label, right? But sometimes the diagnosis can happen in one appointment if the patterns and history are clear. Other times it may take a few visits, especially if they're like overlapping symptoms. Or let's say you have a clinician who wants to employ like additional assessments like neuropsych testing or rating scales. Some do, some do not. And, that doesn't make the evaluation better or worse. It really just depends on what's needed to get the full picture at the time. So at the end of the day, this is the key takeaway for the whole video, right? There is only one evidence based diagnostic framework for diagnosing ADHD, and that is looking at symptoms over time, across settings and understanding how they're impacting your daily functioning. And there's no single test, scan, or shortcut that can replace that. So that's it for today, guys. I hope you enjoyed this content. I hope it was helpful for you. And if you want more evidence based content, go ahead and hit like, subscribe for me, even share this video with someone else who you think might benefit from the information. And make sure to stay tuned for the next video in the series where I am going to be talking about the neuroscience behind ADHD, like what's happening in the brain and why first line treatment helps with that. And I'm also going to cover some additional treatment options for the condition as well. So until next time, take care of yourself. Bye.